Coming up on Mayo Clinic Q&A.
It's okay to seek help. This is stressful for everybody. Everyone is adjusting to all of this. And it's okay to ask for help. It's okay to feel not as well as you'd like to feel.
The COVID-19 pandemic has had a major effect on our lives. Many of us are feeling challenges that can cause stress. Returning to work, the Delta variant, vaccine hesitancy, all can be overwhelming and cause strong emotions. Learning to cope with stress and manage anxiety can start at the smallest level.
Little by little, you kind of make these small reintegrations. And oftentimes, if we start slow, we're able to kind of go back up again. If we give up, there is zero chance for success, right? But if we do it again, there's at least a chance, even if it's minuscule, it's still a chance that we can succeed and at least improve.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Thanks for being here today. I don't know about you, but COVID has been tough for sticking to good habits and not developing bad habits. This last year and a half has created stress and anxiety and changes in many of our lives. And I've had to fight my way back from a few bad habits, and I bet you have too. I have a family practice physician from Mayo Clinic, Dr. Ben Lai, here to discuss this with us today. Ben and I are friends and work together on multiple committees here at Mayo, and I knew he would be just the person to talk with us today. Thanks for being here, Ben.
Thanks for having me, Helena. It's great to be here.
Why in the world, Ben, is it so hard to kick bad habits when you form them?
Yeah, so, I think COVID-19 has presented with just a slew of changes. And I think this all boils down to stress. When we're all under stress, we all revert back to what's comfortable, what we know that's familiar. So what is stress? Well, stress is novelty,
I know it when I feel it.
unpredictability. Yes, unpredictability, a threat to yourself or your ego, and a sense of loss of control. Well, with COVID-19, that's the perfect setup. This is new. None of us have ever experienced something like this before. We don't know when it's going to end. Many of us are faced with furloughs, changes in our routine. We're working from home now. The gyms are closed, and it's a threat to ourselves. Are we going to get sick? Are we going to be safe at work? And we have no control over the situation. And when we're faced with this chronically, and especially with COVID, because some of our traditional coping mechanisms are no longer there. We can't go to the gym anymore to exercise. We can't go visit a friend anymore because we're supposed to social distance. We go back to what's familiar, our comfort eating. Well, some of us seek alcohol. Some of us maybe spend too much time on social media. And so it really is kind of a culmination, and it all boils down to, I think, stress, chronic stress.
And Ben, I think for some individuals, probably the very change in how they work. So you and I still go to an office, to the clinic, and see patients in the clinic, but many of our colleagues are actually working from home now. And I think that just that probably change in pattern as well lends itself to some bad habits.
Yeah, I agree with you completely. I think it's that blurring between what's personal and what's work. I think it's the lack of routine or a change in routine. Many of us just get up and then we go to our desk and we start working, and then we go back and to our families, all in the same living space. And I think oftentimes that blurring really can create psychological and even mental confusion or havoc. And so I think that really is creating more disruptions, if anything else.
Ben, before you and I were going to do this podcast today, I was trying to think up a list of bad habits that I could think of that were a potential during COVID, either that I've had, others have had, or that I could think of being a possibility. One is being at home, and so stress eating and eating comfort foods, and then maybe not staying in your exercise routine, like you mentioned, because the gyms weren't always open. Now some of them are opening in some areas. Alcohol, drinking more because it's an anxiolytic, I guess, and because we're home more. So a lot there, but there are many, many things. And what else do patients talk to you about?
Well, I think a lot of people spend too much time or more than before watching TV, tuning into the news. Social media is a big one. Many just lose the motivation to do their normal tasks. So they just end up sitting and not doing very much. They worry. They watch the news. It's very concerning, and there are multiple issues going on in the news that can consume their energy. And so they feel very lethargic. So one of the biggest things that I hear from patients is that I just don't have the motivation to do anything anymore. And you know, alternatively, there is a small group of patients actually who actually are taking charge and doing more things. I actually have some patients who have lost a lot of weight because they're no
Really?
longer eating out. They're not working as many hours, so they're taking the opportunity to go out for more walks and exercise. But I think by and large, the majority of patients just seem to have lost that motivation to want to do things. They no longer go on vacation, they can't. And so there's nothing really to look forward to. I remember one patient telling me, well, we used to go out for movies every weekend. We can't do that anymore. So what do I do with my family? So I think that is the biggest issue that many patients struggle with, many families.
Ben, how do you know when someone is facing um, a lack of motivation or difficulty engaging, maybe even socially, because of stress? Or how do you know, how does someone know if they're really suffering from significant depression that they should talk to their clinician about? Because that sounds like it could be depression, I imagine.
Yeah, so I mean, it all, initially it's an adjustment. We all kind of adjust to this new way of living. However, if it's prolonged, if it starts to get in the way of them doing their daily routines and their tasks, or some patients are very open with me. They say, I really just don't see a point. I think those are definitely red flags for me to seek help. And it's okay to seek help. This is stressful for everybody. And that's what I tell a lot of my patients. We say that this is perhaps a bit of a hidden pandemic, really, is that everyone is adjusting to all of this. And it's okay to ask for help. It's okay to feel not as well as you'd like to feel. So I encourage my patients actually every time they feel something that's different to come and talk to me. It doesn't hurt to talk about it. And if we deem that this is an adjustment issue, we have plenty, we have some tools to help our patients through. And if we feel that the patient needs a higher level of care, we certainly would offer that.
Oh, that's great to know. So Ben, just thinking back to taking an example of a habit. Maybe we can each identify one habit that we'd like to tweak or change that has resulted from COVID. What are the steps that someone takes when they want to kind of reverse things?
Well, I think let's use weight loss as an example.
Okay.
This is very common, perhaps even more so with the COVID pandemic. Typically, I might have a patient that comes in and says, doc, I'm 50 pounds overweight. I need to lose this, right? Well, 50 pounds is a huge challenge. It's a big
Mhm.
mountain to climb. I think one thing is for us to break things into small, bite-sized chunks. Go out for a walk. Even if it's a 5-minute walk, that's 5 minutes you didn't do the week before. So, and if you're able to meet these small goals, it gives you more motivation to kind of do more the following week.
Yeah.
Sometimes it's helpful. Oh, go ahead.
No, go ahead, Ben. Sorry.
Sometimes it's helpful to write your goals down or to tell somebody
Oh,
about your
yes.
goals. Tell your husband, tell your wife, tell your children. That's a commitment goal. Now that you've committed yourself and other people are there to keep you accountable, or they might want to join you. So, your wife or your husband might say, you know what, I think I need to go out for a walk too. And that
It,
sometimes is helpful.
and it is easier to form a new habit if someone else is willing to do it with you.
Absolutely. And then to keep each other accountable. I think setting your environment up so that it's easier to do these things is helpful. For example, you want to set your shoes up in front of your door, and that way it's easy to do it. And or if you want to eat better, perhaps stocking your fridge up and your pantry up with healthier options rather than some of the unhealthy options. That way, if you're tempted to snack, well, you have to snack on the healthy stuff.
That's right.
And
No tortilla chips are in the
no
cabinet. You have to
tortilla
find.
chips, but plenty of vegetables and fruits and things like that. And I think one thing is, none of us are machines, we're all humans. And I think learning to forgive yourself, we all could revert back to our old habits.
Mhm.
The thing is recognizing it, picking it up and do it again. If we give up, there is zero chance for success, right? But if we do it again, there's at least a chance, even if it's minuscule, it's still a chance that we can succeed and at least improve. So those are kind of the main things.
I like what you said, Ben. It made me think of in my own life, routine is helpful to me. I'm kind of a person of structure. I kind of tend to follow about the same schedule every
Yeah,
day so that I know that I'm going to get up and I'm going to work out and I'm going to fit that in my day somehow. Sometimes
yeah,
I'll even jot notes to remember to go walk up the 20 flights of stairs in this building during a break during the day or something like that. I like goals to set
yeah,
and I like routine. So I think that your techniques for fitting it into your day and making sure that it gets done, that's really helpful.
yeah, yeah. Routine is very important. And I encourage my patients to write things down. Timetable your days. Set yourself a lunchtime, set yourself a time when you go out and exercise. Going back to the example of my patient that says, well, I don't know what to do with my family anymore because every Sunday we would go out for movies. Well, I told that patient, I made the suggestion, why don't we pencil in a family night? We make it something special. We put on a really nice movie, but then we maybe make a meal together as a family with the kids. And that way, even if you can't go out and do what you previously did, you can still make it a special occasion. That way, creating a routine and then having something to look forward to is important.
It is. And I could see that being very valuable to those who work at home too. You mentioned
Absolutely.
making sure that they have a schedule for the day. Well, it's easy to miss lunch when you're
Yeah.
just keeping going on Zoom meeting after Zoom meeting after Zoom meeting, or I'm just going to finish this document because I'm at home and I can run
Yeah.
grab something anytime. So I think that those are
Yeah.
really good points.
Helena, one thing that I have identified is that many of us during this time ruminate. We all think about, "Oh, boy, what am I going to do? Am I going to lose my job? What are my kids going to do?" And so there's a lot of kind of pent up anxiety and stress and irritability and anger even, and that's part of the stress response. Going back to stress, we all have developed a stress response as mammals to run away from our danger. So when we're stressed, our stress hormones are elevated and it raises our heart rate, it increases our blood sugars. Well, sometimes it's helpful to rechannel that energy and actually doing something more meaningful and more active. So I encourage my patients, well, instead of ruminating, let's write that down. Let's try to plan ahead, use that energy. And that way we make it into something that's constructive. And I think that is helpful for many of my patients. And again, just writing it down, developing that routine has been helpful for some.
That's really interesting, Ben. It triggered in me that someone had once told me that anxiety is trying to control things that you don't have control over. And sometimes you have to find a way to control what you can, but give up those things that you can't. And probably
Yeah.
making lists and writing them down is a good way.
Yeah. Yeah. That's a great point.
That's great. We're talking now, Ben, we're past the 4th of July when we had such big, lofty goals for getting the United States immunized. And many people have been vaccinated against COVID and feel that maybe they should be re-engaging, their families re-engaging. People are starting to have weddings again. They're starting to have events, but there may be those who have sort of a reluctance to re-engage just because it's become a habit almost not to. It's easier sometimes to stay home on Friday night than to decide that you're going to go, even if it might be safe to go.
Yeah.
What ways can we encourage individuals who need to re-engage but are having trouble doing so to do that?
Yeah, that's a great point. The re-engagement is another big change, right? For many of us. We've gotten so used to this. We've developed these routines now, working from home, homeschooling, and learning not to leave our house and working out at home. And all of a sudden, we're bombarded with these changes. And there is also so much uncertainty, especially with the Delta variant. There are pockets in the country where COVID is really surging again. So that creates a lot of anxiety and stress. And unpredictability in patients. So one thing that I encourage people to do, again, is to take things small bits at a time. One of my patients, for example, who I saw recently said, I just am not fully comfortable going back to my gym. And I said, well, this is summer. This is the perfect time to walk outside, enjoy the outdoors. Let's try just doing a 10-minute walk outdoors every day. And I think part of that is to create a routine so that you feel comfortable and you feel safe, at least exercising and going outdoors again. And one thing that I always ask people to do is that this has to be a continual daily process. Give yourself no more than 1 day's break, because if you break 2 days in a row, then you're more likely to kind of break it again that third day and that fourth day and so forth. And once you feel comfortable doing that exercise for 10 minutes, maybe you can expand that to 15 minutes or 20 minutes. And then maybe you can call up one of your friends who you used to go to the gym with and see if you could go together. And again, just little by little, you kind of make these small reintegrations. Similarly, people who are concerned about gatherings, I would often encourage, why don't we send them an email? Send your friends or your family an email. Maybe give them a call, do a Zoom meeting. If you feel comfortable, maybe just start gathering in small groups, just 1 or 2 outdoors. And oftentimes, if we start slow, we're able to kind of go back up again. Certainly, letting them know that there is still the possibility of getting sick, and if anyone develops any symptoms, they need to seek the appropriate healthcare and contact their healthcare providers.
And I do think that one of the silver linings, I'm always looking for silver linings of COVID, is that it's okay for people to say, I'm going to wear a mask, or maybe we could wear masks, even if that's not the recommendations of the state or the area that you're in. If there's concern about, children who aren't vaccinated or others who, maybe aren't vaccinated, it's socially acceptable now to wear a mask and to distance a little bit.
It is. And I say, excuse me, and I say, go for it. If you feel comfortable wearing a mask, and you should. We often think about, when people are stressed out, we often think about trying to just tell yourself that it's okay. If we're around people who are stressed, we become stressed. So sometimes it's helpful to be the one that breaks that cycle, right? It's that phenomenon called stress resonance. If I'm in a very stressful meeting, even if I go into the meeting in a good mood, I'd come out feeling like there's butterflies in my stomach, and I think it's important to start, developing these positive habits and positive way of thinking, so that we can we can spread this positive energy and this positive outlook to others or in our family.
We can usually find something to be grateful for, can't we, Ben?
Absolutely. So that's a great point too, Helena. Positive reframing. We want to make sure, even though this has been a tremendous change for all of us, really, there are things that we perhaps can still be grateful for. And so oftentimes we think, at the end of the day, what am I grateful for today? Maybe it's going to work. Maybe it's with your family. Maybe it's just beautiful weather. And I think sometimes in the midst of all the bad news and all the catastrophic news that we hear on TV, it's important to remind ourselves that there are still things that we can be grateful for.
I love that, Ben. I think gratitude is a great habit to develop.
I agree. And I do it every day. So
that's wonderful. Thanks for being here today, Ben.
Thanks for having me.
Our thanks to family practice physician, Dr. Ben Lai, for being here today to talk to us about habits, some of them bad during COVID, but how we can develop some new, better ones. I learned a couple of things today. I hope that you did too. I think thinking about making lists, being accountable, and fitting things into your routine is really important. We wish you the best with that. We wish everyone a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.